Are there any scenarios in which interferon may still have a role in the coming years?
When thinking about interferon, I think it's going to matter whether we're talking about in the countries like US and Europe, or if we're talking about in other parts of the world. In countries like the US, where we have availability of these new direct-acting antiviral medications, interferon's role is really limited and potentially gone. Right now, you could argue that our challenging population of genotype 3 patients, there might be a role there. There were some data that were presented last year that demonstrated that when you added interferon to the regimen of sulfoxafine ribavirin, that was more effective than sulfoxafine ribavirin for particularly genotype 3 experienced patients. But for most of the other populations, there are very effective, much better tolerated options than interferon. When we think about the rest of the world where maybe all these new agents are not available, there are some populations that might do well. We know that patients who have the favorable IL-28B genotype did really well with interferon, and so you can make a great case that maybe they continue those regimens if they're not, or up until they get these well-tolerated oral regimens. But really, when you think about my clinic or really broadly in the US, interferon is essentially gone away at this point.